Hi friends, thanks for joining me today. What I'm going to share with you today is a true story. It is a story of how one of my family members recently had to go through testing for COVID-19. In this video, I will outline the process for testing, the criteria for testing, and our overall experience with the testing process and also the results. Most of us have seen that image floating around online with the long Q-tip that goes way to the back of your throat, or what they call the nasopharyngeal swab. And it has caused a little bit of anxiety, even for myself, just to look at that and imagine that going in is a little bit daunting. But I want to tell you today that the process is actually pretty quick. It is pretty simple. And our family member had absolutely no trouble going through this. In the province of British Columbia, it is recommended to test all individuals with new symptoms, however mild. These symptoms include fever, chills, cough, shortness of breath, sore throat, runny nose, loss of sense of smell or taste, headache, fatigue, diarrhea, loss of appetite, nausea and vomiting, and muscle aches. Less common symptoms include stuffy nose, conjunctivitis, dizziness, confusion, abdominal pain, skin rashes, or discoloration of fingers or toes. All of these warrant testing. Here in British Columbia, there is a nurse's line that we can call for help when we need help with medical issues. We can also call this number if we have any concerns with anyone who might be sick or showing symptoms that could be representative of COVID-19. I started out by calling the nurse's line. I had my personal health number and the number of the individual who was presenting symptoms with me. I was given a full assessment that confirmed that this individual met the requirements for testing. I was then given a second phone number to call to schedule an appointment for testing. A personal health number was required. Our appointment was scheduled for 24 hours after this phone call, so we did wait one day to complete the testing. On the day of testing, we drove to the site, and the appointment in full took about 5 minutes and was completely painless. After this, we waited 24 hours, though I was told results can take 24 to 48 hours. After the 24-hour mark, I called the BC CDC hotline and received our results via phone. I was also informed that if the test was positive, I would definitely be receiving a phone call with the results. In this sense, no news is good news. The next day, we went for the swab. We were sent to a drive-through testing location. I was pleasantly surprised that because it is appointment-based, there are not very many people there. We were actually the only car there when we arrived. We were welcomed by a security guard who was standing underneath a tented area. He ushered us in with hand motions and told us when to stop once we were under the covered tent area. The nurses were to the side and they approached our car once I had shut the car off. I would say that from start to finish, the swab going in and coming out took about 2 to 3 seconds. It was quite painless for the individual who was being tested, and for that I was quite relieved. Of course, a negative test is always great news. We were very happy to hear this, and we were able to continue on with our planned activities over the next days and weeks. Of course, we will be doing all of this with caution, following the protocols that have been laid out. Thank you so much for listening to this video. I really hope that this will help to reduce some of the anxiety and some of the possible resistance to being tested.